Hello everyone, myself Nikita Gore and my today's topic is diabetes. So there are two types of diabetes mellitus and diabetes insipidus. In this video I will tell about diabetes mellitus, which is a common disorder amongst the many people nowadays. So what is diabetes mellitus? So diabetes mellitus, it is a metabolic disorder that is characterized by increased blood sugar level, increased glucose level in your blood. So what is meant by diabetes? Diabetes means polyuria and mellitus means honey. So what are the some causes or types? First of all, we see the classification of diabetes mellitus. There are two types of diabetes mellitus, like insulin dependent diabetes mellitus and insulin independent diabetes mellitus. In insulin dependent diabetes mellitus, there is a destruction of beta cells of islets of Langerhans of pancreas. And in the insulin dependent diabetes mellitus, there is a lack of insulin receptor in response to insulin. So these are the two main causes of these both diabetes mellitus. So insulin dependent diabetes mellitus type first, it occurs before the age of 40, and it may be due to the some latent disorders and all, or maybe due to the congenital disorder. But type 2 diabetes mellitus is commonest among the 90% of individual which do not require insulin. No need of insulin, because there is a failure of insulin receptors in response to insulin. Then it is common among 90% also, and it requires insulin. It does not require insulin, that requires insulin. So it occurs after the age of 40, and some common causes such as obesity, stress, genetic defects, these are the responsible factor, and change in lifestyle, bad eating habit lead to obesity. These are the causes of diabetes. So what are the sign and symptoms? We'll see the sign and symptoms of the diabetes mellitus. So increase in blood sugar level more than 300 to 400 gram per dl, and decrease peripheral utilization of fat in your body, that leads to diabetes mellitus. First will be clinical sign like glucosuria, loss of glucose in your urine. Then we'll see polyuria, increased loss of urine, and that leads to dehydration in your body. Then polyphagia, increased intake of excess amount of food. Then polydipsia, stimulation of hypothalamus center of thirst, that leads to polydipsia, means increased thirst. So it gets patient get more thirsty. Then we'll see osmotic diuresis, then coma, this also seen. Then we'll see many asthenia. Asthenia is a condition, there is a fatigability, weakness. These are the some signs or symptoms we'll see in diabetes mellitus patient. We notice that. So what are the diagnostic tests for this? And one most important clinical sign that I forget to tell, that is acetone breathing, acetone smell in breath. This is a life-threatening condition which is seen in diabetes mellitus patient. Then Kusumal breathing means increase deep and depth of respiration. Increase your respiratory rate, that is known as Kusumal breathing. Then these are the sign and symptom. We'll see the diagnostic test. So diagnostic test will be increase diagnostic first will be postprandial glucose test, then glucose tolerance test. This is commonly known as GTT. GTT will be the test. Then fasting blood sugar level test, then HbA1c, hemoglobin A1c test. These are the some tests we will do in diabetes mellitus patient. So how will you control? By your diet and lifestyle. By changing lifestyle, most of the people have reversed their diabetes and they had taken their diabetes in control. So take less amount of salt in your diet, take excess of fruit and green leaf vegetables in your diet. Then keep your weight in your control, don't get obese, regular exercise, take healthy diet, take diet rich in vitamins, minerals and carbohydrate. These are the some lifestyle changes that will keep you away from diabetes, that decreases your risk towards diabetes after 40 or before 40. Some types like gestational diabetes, means pregnant women get diabetes due to hormonal changes, and after that after the parturition or delivery it gets rid of this. Okay, so these are the some diagnostic features, diagnostic tests. Then we'll see, and diet management with keep physically active to you, that also decrease your risk to diabetes. So come to the point, homeopathic management. So homeopathic management for diabetes mellitus is first medicine will be the conium. Conium for numbness of feet. Okay, numbness in feet, hands. Conium will be the good homeopathic medicine, because there is a in diabetes mellitus there is a complication known as diabetic neuropathy. Diabetic means related to nerves. There will be a damage to nerves or many disorders. Then diabetic neuropathy, diabetic retinopathy, and some cardiovascular disorders like myocardial infarction and hypertension. This is the complications of your diabetes mellitus. So you have to control your diabetes by diet and lifestyle changes. So next homeopathic medicine will be the phosphoric acid. This is also the good medicine in homeopathy that control your blood sugar level and that keep your normal blood sugar level, because if sugar level rises above the 180 gram per dl, that leads to diabetes mellitus. Then third medicine will be the phosphorus. Phosphorus is also good melon for this. And then we'll see argentum metallicum. When there is a unconscious urine in diabetes mellitus patient, then we'll give the argentum metallicum because it works well. Then next medicine will be the natrum mur. Natrum mur is also good medicine homeopathy that maintains your body fluid retention. Okay, that keep your ions in balance, that sodium potassium ions in balance, so electrolytic imbalance will be not there. So in that patient will give polyuria, polydipsia symptom showing patient will give the natrum mur. Natrum mur is good medicine for in homeopathy for the diabetes mellitus. The next medicine will be the natrum phos. Natrum phos 3x will be given in diabetes mellitus. Okay, so for more updates and getting more updates, please like, share and subscribe my channel. Thank you.